lots of ways to have a well-rounded self-care routine, but have you ever thought about keeping your gut in check to improve your mental health? We sit down with one local physician to learn about the connection between your gut health and the impact it has on your mental health.
You have more nervous tissue in your gut than you do in your brain and your spinal cord combined.
Your gut health might be impacting more than you think.
We have like 100 million neurons that are inside our gut, and it's categorized as enteric nervous system. That's the broad term that defines the neural network that you have in your gut. What now we're discovering is that actually how those neurons in your gut interact with the diseases or the pathology in your gut, it actually is not just a one-way traffic from your brain to the nervous system in your gut. It actually is a feedback loop where the health of these neurons does affect the state of your mind by itself. Health of the gut itself and the kind of stimuli that the neurons are carrying that carry back to your brain does affect your mental health as well.
Dr. Abhishek Gulati says this link influences other aspects of your well-being also.
Majority of the serotonin in our body is actually produced by these cells called as enterochromaffin cells, which reside within your gut.
Chemicals like serotonin carry messages between your nerve cells in the brain to the entire body, and there could be a few indicators that your gut isn't functioning properly.
Oftentimes we'll get patients with a broad spectrum of symptoms, most commonly abdominal pain, not feeling well after having a meal, feeling full easily, having discomfort in their belly, having issues with their bowel movements.
Overall, Dr. Gulati says improving your mental health could mean keeping your gut health in check.
Fiber intake, both soluble and insoluble fiber intake. The soluble fiber would be the one that gets digested into nutrients that help feed the healthy bacteria in your gut. And the insoluble, think of it almost like a scrub inside your gut. So that kind of washes away the toxins that are inside your gut. Second thing we commonly hear about is prebiotics and probiotics. Prebiotics would be foods that help with producing certain nutrients in your gut that would indirectly stimulate the healthy bacteria in your gut. And probiotics would be taking a dose of the actual healthy bacteria to supplement the bacteria in your gut. The third thing I tell my patients is to avoid foods that are directly toxic to your gut. So heavy intake of alcohol, for example, smoking, taking medications like Motrin, ibuprofen, Advil, Aleve. Those are inflammatory to your gut.